We're still in a skin cancer epidemic. Skin cancer is the most common cancer in the United States. 1 in 5 Americans will develop a skin cancer during the course of their lifetime. I'm Dr. Oma Agbai, Associate Clinical Professor of Dermatology at UC Davis Health and Director of Multicultural Dermatology and Hair Restoration. I see skin cancers diagnosed every single day in my clinic. It is a very common diagnosis, and if you have a skin cancer diagnosis, it can be cured, but it's not a little thing. You know, these surgeries, they're not a small deal. They can leave scars, which can be visible for life, and so really the best thing is just to prevent them in the first place. If you have a spot that is growing, changing, itching, painful, or just looks different from your other spots, definitely call your board-certified dermatologist and get that spot evaluated. And regarding melanomas, we have something called the ABCDEs of melanoma to further guide you to identify spots, moles specifically, that might be abnormal. And A stands for asymmetry. B stands for borders. The borders are irregular. C stands for colors. There is a variation of colors within the same mole. D stands for diameter. It's larger than a pencil eraser on the end of a pencil, larger than 6 millimeters in diameter. And E stands for evolution. It's growing or changing over time. So you could also think of it as the ugly duckling, the spot that's just different. If you notice any of those things, definitely reach out to your board-certified dermatologist as soon as possible. So dermatologists don't want to stop you from enjoying the spring and summer. Dermatologists love to be outside in the sun just like anyone else and enjoy a beautiful sunny day. The critical thing is to make sure that you're enjoying the outdoors safely, that you're seeking shade when you can. When you're out in the sun, you're wearing your protective clothing, your long sleeves, your sunglasses, your wide brim hats that cover your ears and neck, and that you wear your sunscreen, at least SPF 30 on all of the exposed areas. You bring it with you and reapply it. You want to make sure you're not using tanning salons. That's something that's been re-emerging, so we want to stop that. And we don't want to be exposing ourselves to the sun in ways that can accumulate over time and lead to an increased risk for skin cancer. So we hear a lot about the shot glass, right? So you fill up a shot glass and that's enough. But that's actually outdated because people come in all shapes and sizes, and that might not be enough. So if you try to just limit it to that amount, there might be some under application of sunscreen. So what you want is you want to make sure that you're rubbing it in to the point where you're seeing a visible, even film on the skin, all areas that are exposed to sun. And once you see that even film, then it should absorb and become a little bit less visible. But when you're applying it, you want it to be an even film on all the sun-exposed areas. You know, a lot of people, they don't like the feel of sunscreen. It's greasy, it makes their skin look chalky, but sunscreen has come a long way. So look online, do a little research, look at sunscreen that applies nicely, that doesn't leave a chalky film, and there are a lot of options. It can rub in nicely without leaving you feeling greasy. The key is to find one that you're willing to use regularly.